Morning, everybody. I'm Dr. Kelly McCaul, and I'm a hematologist here at the University of Tennessee Medical Center. And by trade, a hematologist, but also have a little bit of immunology background given the field that I work in. I'm relatively new to the University of Tennessee, but really good to join. And today we're going to talk a little bit about the COVID and coronavirus, in addition to the vaccines that are present out there. And one of the things that has been discussed is really the impact that COVID has had upon the oncology community. And there's obviously a lot of information out there, and so today we're going to discuss a little bit about that and talk about the impact as well as the vaccines that are present in the world now. And so one of the common themes that has come up is really what is the impact that coronavirus is having upon the oncology community. And there's no question that people that have cancer and are undergoing treatment and chemotherapy, radiation therapy, we all know that they actually have a slight reduction in their immune system. And so that alone actually will put them at risk for the coronavirus. And so general population, so individuals out there, they may have a little bit more of an immune system that can help fight off the COVID virus. But our patients that are in the oncology community, they without question have some or even a lot of reduction in terms of their immune system, and so are more at risk. And so one of the common questions that comes up is really whether, so what happens when people do have some symptoms that might be related to COVID? And this is a very common thing because in our world, when the people are undergoing treatment, they often have things like fever or cough that may not be COVID, but we're never totally sure. And so we would really kind of guide people and tell people that any symptoms that they're having, like a fever, a cough, or other symptoms that might be related to COVID, we play the safe card and we say, okay, go in and get tested. One of the things we don't like to do is we don't like having people come into our office when they're symptomatic, because there is a lot of COVID that's going through the community, and so we don't like to have people come in and be assessed in our office, because then they actually put all the other patients at risk that are compromised. And so that's one of the kind of many kind of typical scenarios that we would deal with. And it's not that we don't want to take care of you, it's really just that we need to take care of you in the right spot. And so that's where we direct people away from our clinic and into a designated site that will be able to kind of work you up, take care of you, evaluate your symptoms. And if it's COVID, then that's fine. Most people do great. But then at least it doesn't put other at-risk patients at an exposure level that is really unacceptable. So that's one of the common things. One of the other questions that comes up is the monoclonal antibody infusions. There's no question since the beginning, and I helped run some of these clinical trials actually in my former life and prior to coming to the University of Tennessee. The monoclonal antibody infusions are without question beneficial. We now know that to be scientifically proven. We expected that result, and so patients that have cancer or are undergoing treatment, chemotherapy, if they have the coronavirus, the monoclonal antibody infusions are still recommended, and so that would be a good thing for people to do. So another question that kind of comes up is, what can a family member, a loved one, a caregiver, what can they do to help with regards to this whole scenario? There's no question that one of the common things that we would recommend is vaccinations for all people involved. We know there's very high level evidence of vaccines that are very effective across the board. It's difficult because with that reduced immune response that patients undergoing chemotherapy or radiation and having cancer, yes, they have a reduced response to the vaccine, but the flip side is that they still gain benefit. And this is a common scenario in things like stem cell transplantation or other arenas where we vaccinate people after they've had transplant. It may not be as effective as people that have a full and robust immune system, but it's still beneficial. So, so patients and their family members and caregivers, we do recommend the vaccine across the board. Really, I don't think there's any population of people that wouldn't receive benefit from the vaccine. Given that it's so new, there's really not going to be, and it's a new platform for vaccine. There's really nobody that it would be contraindicated in. So in terms of the vaccination schedule for patients, there is of course a time that would be a little bit better. People can have some symptoms from the vaccine. But the flip side is obviously getting COVID is much, much worse. And so, there's a lot of information out there on a lot of different sites about the vaccine, and but really, without question, vaccines are beneficial for everybody. And so we would recommend vaccination essentially almost across the board. There are a few people that the vaccine may cause some other issues with, such as autoimmune diseases, but then the risk and benefit has to be weighed carefully. Discussion with your physician would be important, and there still might be benefit even in that patient population, because again, if you have a certain percentage of side effects, if you have an autoimmune disease with the vaccine, getting COVID is usually much worse. And so that careful discussion with your physician in any different scenario is important. We know that, again, we kind of go back to the reduced immune response. Even if patients have a reduced immune response to the vaccine, they still gain benefit from it, because again, the key and the importance is to prevent getting the COVID virus, prevent hospitalization, prevent the ICU stay. So vaccines are important across the board. One of the other important pieces that comes in is also, we all know that the coronavirus vaccines that are out there are usually 2 doses. We do this actually to help set the immune system so that it actually has a more robust and a higher response to the vaccine. So first dose is very important, even though it covers a large percentage of patients in some level. There's a higher response to the second dose. And so now, as we all know, there's also now kind of booster vaccine dosing that comes in. And the booster vaccines, this is a very rapidly moving target in the space across the world. And all the different countries are dealing with this slightly differently. Having said that, we know that the data is absolutely irrefutable. We know that the third dose for many of the patients, many of the people that receive third dose, you get actually, and I saw this just published in the last few days, an 1,100% increase in the antibody production. And so it's a very, very robust immune response, which is excellent, because that third booster dose will help protect people. With regards to exactly who would be able to be covered and receive the booster dose, that actually is different in every country right now. It's a moving target. Currently in the United States, I couldn't tell you the exact, but I think that it's in the range of the age of 55, 50 or 55. Like I said, it changes virtually every day. So going to the cdc.gov website will help kind of give people, and we can provide some links on the Facebook Live as well. So, but having said that, again, I'm going to come back. third dose is absolutely effective. I think in the future, what we're likely going to see, and I don't know if this has been even settled yet, but it's likely we're going to see recommendations that people get COVID vaccine on an annual basis. Maybe it might be 2 shots, it might be 1 shot. I don't know if anyone knows yet because it's all so new. But currently, third dose booster is coming in. Patients that are immunocompromised, that like our cancer patients that may have had a lower immune response to the first or the second dose, third dose hopefully will bring them up to more protective levels. So there are, again, a lot of kind of moving pieces to this, as everyone knows. The global pandemic has been kind of rewritten kind of components of history here. Take faith in the vaccines. They've had many years of development. Most of them have been in development for in the range of about 15 to 20 years. And so even though they look new to the population, they've actually been there for a long time in terms of development. It was really just good timing that we were able to kind of put them into practice sooner than later. So there's many components that come into that. In terms of scheduling and vaccines, I know that there are many different varieties out there at the University of Tennessee. There are some websites that people can go to that would be able to kind of get them to either sign up. Some places it's even just walk in. You could go to many pharmacies around the area, wherever you are. I know almost all the pharmacies have just a walk-in clinic approach, and so people can get vaccinated. So again, very strongly recommended that vaccines are put into play. Hopefully, once we can attain a high enough level of vaccines in the population, we will see a reduction in some of the variants that are emerging. They're really emerging because there's not enough, quotes, herd immunity. So the COVID is in the community. If there's not enough people that are vaccinated, these things will emerge up and they'll flare. So hopefully we'll be able to get enough people vaccinated in the community. That will definitely shut down the variants that are actually emerging across the world. So there may be some questions because this is a Facebook Live, and if there are questions, be more than willing to take them at this point.
Yeah, thank you, Dr. McCaul. We do have a few questions. So the first, you kind of covered earlier, but could you walk through the steps? What should an oncology patient do if they start experiencing COVID-like symptoms?
So if an oncology patient is experiencing some symptoms that could potentially be related to COVID, and these are very non-specific things like fever, cough, maybe some diarrhea, it could really look like a whole bunch of things. Anything that could possibly be related, we would say take the safe approach, put the phone call in, talk to one of the providers, and then get assessed. And the key there is not to necessarily come into our clinic to get to expose other people, but to go to more of a dedicated site. I know that there are dedicated sites at the University of Tennessee that actually handle rapid testing. And I went to Canada last week. I went through that rapid test site in the parking garage. It was spectacular. It was very efficient, and the staff there are wonderful.
Great. And then we have another question about, you had mentioned earlier just how things are changing constantly with some of the information, and there's a lot of misinformation, or just a lot of misinformation online. Are there some good sources that you would recommend to refer to when doing research or finding information about COVID?
Yeah, so for better or for worse, these things that we call phones and websites and internet, everybody has become an expert, and I think even for myself, who have some background, I have we ran all the clinical trials in COVID at my former employment site in South Dakota, where I came from. Even for myself, I don't feel that I am the expert. But having said that, everybody's become an expert. There's a lot of information out there. I have 20-year-old twin girls that have a fairly large social media presence, and unfortunately, for better or for worse, there's things that get propagated through the internet and through different websites. Always going back to a very reputable website is absolutely critical. The CDC, the website, I've looked at many times in the last year and a half, more times than I've ever looked at it before in my entire life, for sure. With the pandemic, and so going to the University of Tennessee website, they've got very up to date. They will hyperlink into the CDC. The Centers of Disease Control. Those are really the types of websites that we should be focused and looking at in terms of gathering information.
Wonderful. Well, thank you so much for your time today, Dr. McCaul, and sharing this information.
Well, thanks for everybody to be here. Appreciate it. And let's everybody get vaccinated.